U.S. Migraine Management Guidelines, ACP versus AHS clinical debate. Migraine remains one of the most common and disabling neurological disorders worldwide. In 2025, two major U.S. organizations released recommendations that have sparked significant discussion among clinicians: the American College of Physicians, or ACP, and the American Headache Society, or AHS. Let's examine the key points in the ongoing debate. ACP Guidelines, Outpatient Management of Episodic Migraine. The ACP guidelines focus on non-pregnant adults experiencing episodic migraine, defined as 1 to 14 headache days per month. For acute treatment, ACP recommends early combination therapy. The preferred first-line approach is a triptan combined with either an NSAID or acetaminophen, initiated as soon as possible after migraine onset. For patients who do not achieve adequate relief with acetaminophen or NSAIDs alone, ACP advises adding a triptan immediately rather than delaying escalation. When it comes to migraine prevention, ACP prioritizes therapies supported by effectiveness, safety, and economic evidence. Recommended first-line preventive medications include beta blockers such as metoprolol and propranolol, anti-seizure medications including topiramate and valproate, the SNRI antidepressant venlafaxine. The ACP rationale emphasizes cost-effectiveness and extensive clinical experience with these established therapies. AHS Emergency Department Update. The American Headache Society's 2025 update focuses specifically on adults presenting to emergency departments with acute migraine attacks requiring parenteral treatment. Level A must offer. The strongest recommendations include intravenous prochlorperazine, greater occipital nerve blocks. These interventions are supported by the highest level of evidence for effectiveness. Level B should offer additional recommended therapies include intravenous dexketoprofen, intravenous ketorolac, intravenous metoclopramide, subcutaneous sumatriptan, supraorbital nerve blocks, eptinezumab for appropriately selected patients. Treatments to avoid. The AHS strongly discourages intravenous hydromorphone and other opioid therapies because of concerns regarding efficacy, dependency, and adverse outcomes. Additionally, intravenous acetaminophen is classified as a therapy that generally should not be offered in this specific emergency department setting due to limited effectiveness. The clinical debate: economics versus pharmacological evolution. One of the most controversial aspects of the ACP guidelines is their position regarding newer migraine-specific therapies targeting calcitonin gene-related peptide, or CGRP. These include CGRP monoclonal antibodies, small molecule CGRP antagonists known as GPANTs. Critics from the headache specialist community argue that ACP recommendations may unintentionally support restrictive insurance policies by not recommending these newer agents as first-line treatments. They point to evidence showing improved tolerability, favorable safety profiles, and migraine-specific mechanisms of action compared with many traditional therapies. Supporters of the ACP position emphasize the importance of balancing clinical effectiveness with affordability and healthcare resource utilization. The valproate controversy. Another major point of discussion involves the inclusion of valproate as a first-line preventive therapy. Headache specialists express concern that stronger warnings should accompany its use, particularly for women of reproductive age. Because valproate is associated with significant teratogenic risks and other safety concerns, many specialists recommend prioritizing safer alternatives and reserving divalproex or valproate for carefully selected patients. Key takeaway: both organizations agree that migraine management should be evidence-based and patient-centered. The ACP emphasizes proven, cost-effective therapies that are widely available. The AHS highlights emerging evidence, migraine-specific treatments, and advanced interventions for acute care settings. As migraine therapeutics continue to evolve, clinicians must balance efficacy, safety, patient preferences, access, and cost when selecting the most appropriate treatment strategy. Video description. This educational video reviews the 2025 U.S. Migraine Management Guidelines, comparing recommendations from the American College of Physicians, ACP, and the American Headache Society, AHS. Learn about acute treatment, preventive therapies, emergency department management, CGRP-targeted medications, and the ongoing debate surrounding cost-effectiveness versus therapeutic innovation in migraine care. presented by Dr. Khaled M. Hasan, Professor of Clinical Pharmacology and Clinical Research.